Now it is time to look at the current ADA Universal Dental Claim Form. The current ADA insurance claim form is divided into 58 boxes or sections. In the upper left corner of each box, there is a number identifying the information that needs to be in that field. Is for statement of actual services or request for pre-authorization. Box 2 is for the pre-authorization number. Box 3 is the section for the name and address of the insurance company that we will be sending this claim to. Box 4 through 11 is the information for the second subscriber in the event there is dual insurance. Box 12 through 17 is the information on the policyholder or the subscriber. Keep in mind the policyholder and the patient can be two separate people. If the policyholder and the patient are the same, box 18 through 23 would remain blank. This next section is for the record of services provided. If you look at box 24, this is for the procedure date. That procedure date would be blank if we're sending in a pre-authorization. Box 25 is for the area of oral cavity, and that would be in the event that we are working on the upper arch, which would be UA, the lower arch, which would be LA, the upper left quadrant, which would be UL, the upper right quadrant, which would be UR, the lower right quadrant, which would be LR, or the lower left quadrant, which would be LL. Box 26 is for the tooth system. The tooth numbering system, JP, is the number system that is the universal system in dentistry, and that would be what would be filled in this box automatically. Box 27 is for the tooth number or letter. Box 28 is for the tooth surface, and 29 is populated with the ADA code number for that procedure. Box 30 is the description. Box 31 is the fee charged by the office. For box 32, you would get the total of another page. That is in the event that you have more than 10 services and they would go on a second page. Box 32 would be the total of the second page, and box 33 would be the total of both pages. Or permanent, and this would be filled out in the back office by the clinical staff. This would be where we would write a narrative for something that could not be seen on the x-ray or the photos. Keep in mind, in this box, we do not want to highlight anything. We want to keep just written text in there. If we highlight something in this box, the computer at the insurance company will mark it blank. For signatures of the subscriber, box 36 allows the doctor to send the information to the insurance company, and box 37 allows the doctor to get paid. In both cases, it is perfectly acceptable to use signature on file. Box 38 through 47 is for supporting information. If you look at box 38, you check off whether the service was rendered in the provider's office, the hospital, emergency care facility, or other, and other would be a school or a skilled nursing facility. Box 39 will be populated with how many radiographs, oral images, or study models that are sent in with this claim. For box 40, we fill it out in case the patient is having orthodontic treatment. 41 would be when the initial banding and bonding took place of the braces. 42 would be how many months remaining for treatment. And box 43 would be if we are doing a crown, bridge, or partial or denture, and we are replacing an existing apparatus. In that case, we would check off yes, and then for box 44, we would put the date of the initial placement of that particular crown, bridge, partial, or denture. In box 45, we mark off whether this is treatment resulting from an occupational injury, which would be workers' comp, an auto accident, or an other accident, and the other accident would be considered under premise insurance or liability insurance. Box 46 and 47 are the date of the accident and the state it was in if it was an auto accident. Box 48 is the information of the dental practice. Now this would actually be the name of the corporation. Box 49 is for the NPI number, which is called National Provider Identifier. Now this box would be automatically populated from the computer software system. Dentist. The difference between section 48 and this section is that section 48 was the corporation. Section 53 is the doctor that actually did the services. So you could have a group practice name in section 48, and the doctor who actually did the work would be section 53 through 58. Please fill in the forms according to your exercises that are in this section. Also, keep in mind that as of 2014, there will be some new features on the universal claim forms.